Welcome to Caring for People with Dementia, a primary care partnership. This is Lesson 3, Providing Guidance. Research studies have indicated that people with dementia and their care partners feel they receive insufficient information and support from their primary care providers after receiving a diagnosis. Providers report challenges in managing disease complexity and knowledge, time constraints, and uncertainty of diagnosis. Yet, ongoing information provision and support has been identified as a key component of optimal dementia care. People with dementia and their care partners have reported that insufficient information and support has contributed to their overall distress related to the diagnosis, including feelings of helplessness, misperceptions of their conditions, its symptoms, its progression, and prognosis, a decreased sense of competency in managing the condition, challenges in adapting to changes, uninformed decisions, and an inability to plan for the future. In the spirit of patient and person-centered care, the perspectives of people with dementia and their care partners gives us important insight into the type of information and support that is desired. Here are some of these perspectives.
I think we had a few questions as where do we go now? What do we do now? I did have one physician that referred us to the Alzheimer's Association and referred us to a geriatric testing center that offered a lot of needed support, explained a lot of things to my husband and I. But yeah, I think even to this day, we still have questions about, what's going to happen, where are we going to go, how is this going to end. I think we all know that, but it's still questions that it would be nice for someone, a physician, to sit down and talk to us compassionately and explain to us, how the process goes.
And also do more research about the positive effects of homeopathic medicine for dementia patients, especially if your patient is from Asian descent, because Asian tends to use lots of homeopathic meds. And aromatherapy, Ayurveda, massage, acupuncture, all this kind of stuff. So if that can be part of the holistic approach, it's a lot better, I believe, and it can help a lot of our patients.
Primary care physician, she was very keen to, I think, just understanding, probably having seen it before, the progression, and me being the caregiver and the family member who wants to see our loved ones just live as long as they can. I think she was very realistic in telling me and saying very carefully, telling me where she thought she was. And I would recommend that she be placed on palliative care, or I think it's time that we start talking about hospice. And while that was a hard conversation, I did appreciate it.
Research and practice tells us that people with dementia and their care partners want information and support for their condition. Overwhelmingly, research on support needs finds that optimal support is ongoing, flexible, sensitive to diverse needs, such as those with younger onset dementia or various ethnic groups, takes into account the needs for continuity of care, and manages care needs and safety with awareness of the person's identity and dignity. Because each experience of dementia is unique and each person has unique life circumstances, ongoing conversation, including care planning, is a key way of providing guidance to ensure that information is translatable to their daily lives and meets people where they are in the disease process. Areas to cover in these care planning discussions include patient and care partner understanding of dementia and its progression, patient and care partner hopes and wishes for future health, Patient and care partner worries about future health. Patient support system. Patient and care partner financial preparations. Patient advance directives. The following video provides some examples of care planning in action.
So, Mrs. Wilson, let's start with you. How do you think you're doing?
I know that you mentioned last time that I might have more problems getting turned around. That is happening. I went for a walk and found myself in a totally unfamiliar area and didn't know how to get back home. Luckily, I had my cell phone and I called Mike, but that really upset me.
That must have been very scary for you both. But yes, getting turned around, your orientation, can become very challenging with Alzheimer's. The parts of your brain that are like a GPS system can be affected by the disease. A patient once told me that he felt like his compass wasn't working. It is important that you continue to do the things that you love, like walking, but we also want to make sure that you feel comfortable and safe. I'm glad you had your phone. Another patient told me that his wife put an app on his phone to help track where he was when he went walking. This allowed him to keep his independence while walking, but allowed his wife to track him down if he needed it. That's just a thought on what might work for you. We can work on other solutions if this becomes more of a problem.
Okay.
There are a lot of things to think about, and this is an ongoing conversation. The Alzheimer's Association also has programs that can help with this. They are called early stage programs. And from my perspective, I will do whatever I can to help you with this process. What is the biggest challenge you feel you have right now with Alzheimer's?
I just can't stand that I forget things. It's just so maddening. Mike is great. He helps me a lot. It's just so maddening. I know that I have to let things go.
That does sound really frustrating, Mrs. Wilson. I have a number of other patients who also feel the way you do. Mr. Wilson, how about you? What do you feel the biggest challenge is right now?
I'm getting worried about things like her not eating or walking alone, getting locked outside the house, or forgetting to turn the water off. I keep thinking about all the things that could happen to you while I'm not there to help you, honey.
Oh, Mike, I know you worry. I worry too.
Mrs. Wilson, what are your thoughts?
Well, I feel like I'm fine. There are things in place to make sure that I'm okay. Not gonna get myself in any trouble. Am I not okay to be alone?
I'm glad we're talking about this. It is a difficult conversation to have, but I want us to have a plan. It might be that at some point it would be difficult for you to be home alone because we'd be worried about your safety. There are some things you could do now, some safeguards you could put into place to be home alone safely. And then we should think about what'll happen if you can't be alone by yourself. It is most important that we hear from you, Mrs. Wilson, about what matters most to you, that you are a part of this conversation and we can make a plan together.
Primary care providers can provide information and support through ongoing care planning. Ongoing guidance and conversation is vital to quality of life and care, and is a response to the expressed support needs of people with dementia and their care partners. As you look for opportunities to apply what you've learned, consider trying one of these microsteps. Identify a professional to whom you can refer patients with dementia to have care planning discussions if you are unable to do so. Develop an approach to encourage patients to complete advance directives. Encourage care partners to be mindful of their own health and practice self-care. Or come up with your own microstep. Each microstep moves you forward to a primary care partnership with your patients with dementia.